Emergencies and disasters are part of our reality. These include typhoons and earthquakes to pandemics and industrial accidents. These events can disrupt health systems and threaten lives. The Health Emergency Management Program, or HEMP, prepares the health sector for any hazard, be it natural or man made. Its ultimate goal is to build resilient communities that can prevent, prepare for, respond to, and recover from disasters. As CHNs, our role in this program is very important. We are the bridge between the health system and the community during times of crisis. The Health Emergency Management Program is guided by Republic Act 10121, or the Philippine Disaster Risk Reduction and Management Act of 2010. This law transformed disaster response into a comprehensive system emphasizing prevention and preparedness, not just reaction. The program is operationalized through the DOH Health Emergency Management Bureau, which leads national health emergency efforts. It also aligns with the National Disaster Risk Reduction and Management Plan, which ensures that the health sector's actions are coordinated with local and national disaster management systems. In short, the law and these structures ensure that disaster preparedness is not optional. It is a duty for all health professionals. HEMP envisions a healthy system that is disaster resilient and responsive to emergencies. Its mission is to ensure timely and efficient delivery of health services before, during, and after disasters. That means making sure that hospitals, RHUs, barangay health stations continue to function even under extreme conditions. HEMP upholds the Department of Health's mandate to protect health and save lives in all circumstances, no matter the size of the disaster or the location of the affected area. The key objectives of the program includes strengthening the capacity of health facilities and LGUs to manage emergencies effectively. These includes training, planning, and resource allocation. Enhancing preparedness and risk reduction strategies at every level is another objective. This means ensuring preparedness from the barangay to the national level. Another objective is to ensure continuity of essential health services during crisis. Even when disasters strike, vaccination, childbirth, and healthcare in general must go on. Preparedness saves lives, and the earlier communities plan, the faster they recover. The Philippines faces a wide range of emergencies that HEMP addresses. This includes natural hazards such as typhoons, floods, earthquakes, volcanic eruptions, and droughts. We experience about 20 typhoons every year, making preparedness critical. Another type is human induced emergencies, which involves fires, industrial accidents, transport incidents, and armed conflicts that displace family. Biological emergencies cover epidemics and pandemics like the COVID 19, dengue outbreaks, or foodborne diseases. We need to understand this category to help us anticipate community risks and tailor health interventions accordingly. Disaster management follows a continuous cycle with four major phases. We have prevention and mitigation. These are efforts to reduce the risk and vulnerabilities, like enforcing building codes or flood control measures. Another one is preparedness, which involves planning, drills, and training to ensure readiness before disasters occur. And then we have the response and recovery, which is providing immediate life saving assistance during disasters and helping communities restore health services afterward. Each phase is interconnected. Good prevention and preparedness lead to faster recovery and fewer casualties. Prevention is always better than cure, even in disaster management. Communities perform hazard mapping and vulnerability assessments to identify high risk areas. We often help gather data for this. The government enforces building codes and environmental protection laws to reduce damage during disasters. Equally important is health education on disaster risk reduction, which builds community resilience. Teaching families how to prepare go bags, secure water sources, and create family emergency plans can save lives. Preparedness involves clear planning and continuous practice. HEMP ensures the establishment of health emergency response teams, or the HERTs, at both the local government unit and facility levels. These teams are the first to respond when a crisis hits. Regular drills and simulation exercises help health workers stay ready for earthquakes, mass casualty events, or disease outbreaks. Prepositioning of emergency supplies and logistic support, such as medicines, tents, and PPEs, ensure a quick response even when transport lines are disrupted. When disaster strikes, the response phase begins. This involves rapid deployment of health teams and mobile medical units to affected communities. Nurses often lead triage areas, prioritizing who needs urgent care. The response phase also includes provision of first aid, triaging, and evacuation assistance. Clear communication and teamwork save lives during this critical stage. Coordination with LGUs, the Red Cross, and other response agencies ensures unified action and prevents duplication of efforts. After the immediate response, the next phase is recovery and rehabilitation. This involves the restoration of health facilities and services so communities can return to normal operations. This also includes psychosocial support for both affected populations and exhausted responders. Recovery includes evaluation of the response effectiveness and updating contingency plans for future emergencies. Every disaster teaches us something that helps us prepare better next time. The health emergency management structure is a system that is led by the Department of Health, Health Emergency Management Bureau at the national level. It is linked with LGU disaster risk reduction and management councils that coordinate operations locally. The structure involves coordination among DOH, DSWD, OCD, AFP, PNP, and NGOs. This demonstrates that disaster management is a whole of the government and whole of the society effort. Our role as PHNs during disaster is crucial. We participate in risk assessments and community preparedness planning, which help identify vulnerable populations like children, elderly, and persons with disabilities. We provide first aid, triage, and health education during emergencies to ensure immediate care and awareness on hygiene and disease prevention. We also conduct psychosocial support and disease surveillance in evacuation centers, monitoring for possible outbreaks like diarrhea or measles. Community based preparedness ensures that local people are the first line of defense. The Barangay Health Emergency Response Teams, or the BERTs, serve as frontliners. They conduct first aid, reporting, and isolation if needed. Local health workers receive training in surveillance and evacuation procedures. PHNs supervise and guide these teams, ensuring that response activities are well coordinated and aligned with DOH standards and protocols. Disasters do not just cause physical injuries, they also cause emotional trauma. That is why psychosocial or psychological first aid or PFA is provided to affected individuals and families. Nurses help survivors process their emotions and regain a sense of control. We also help manage stress and trauma among both survivors and responders who may suffer from exhaustion or secondary trauma. We collaborate with DOH mental health units for referrals and follow ups, ensuring that emotional recovery accompanies physical healing. Logistics are the backbone of effective disaster response. This includes stockpiling and rapid mobilization of medicines and medical supplies. Without ready logistics, even the best health teams cannot function. Efficient transport and distribution systems ensure resources reach even remote disaster zones quickly. The process is monitored through the DOH Logistic Management Information System, which tracks supplies and ensures accountability. Disaster response thrives on partnerships. Coordination with LGUs, NGOs, the military, and international partners maximizes manpower, logistics, and technical support. These collaborations strengthen resource sharing and unified response actions, reducing duplication of efforts. Community participation ensures inclusivity and sustainability. When communities are involved, they own the process and recover faster. One of the challenges in the implementation of the Health Emergency Management Program is often inadequate funding and logistic support, specifically in remote and geographically isolated areas. This program also faced limited trained personnel for large scale emergencies, especially in small municipalities. Then there is also weak coordination among local agencies during multi hazard events, which can delay responses. Strengthening communication and leadership at the LGU level remains a priority. To recap, the Health Emergency Management Program ensures that the health sector is prepared, responsive, and resilient in any emergency. PHNs are key players in risk reduction, emergency care, and psychosocial support. We serve as both care providers and community leaders during crisis. A resilient health system, one that safeguards lives and sustains well being, depends on collaboration, continuous training, and the unwavering commitment of health professionals like you.